For the last 25 years, Dr. John Steele has been the physician director at the skilled nursing unit in Barrigada.
I'm very proud of the job I do there. I'm very proud of the staff. We have a wonderful morale, and I think it's that morale that's reflected in the good patient care we provide.
That all changed, though, on February 3rd when he was terminated.
As a contract employee, I'm not entitled to any explanation, any due process, and I have no legal recourse at all.
Dr. Steele was fired about a week after the Centers for Medicaid and Medicare Services conducted a survey of the SNU. He says they noted multiple deficiencies, specifically in nursing care. But the former physician director contends that part of CMS's concerns were a result of management not keeping to the established rules of GMH and Medicare policies and procedures.
I try and keep to the guidelines that are set by Medicare, overridden by Vega or Lizama. So it's been constant interference.
Steele claims that since the new GMH management was put in place last year, things have gotten personal.
Both these people, Ray Vega and Lizama, have interfered constantly with my management and decision-making out at skilled nursing. They've sabotaged the unit and me during the past year.
The termination also came a few weeks after Steele was counseled for a procedure he conducted on an SNU patient who suddenly had difficulty breathing.
And to save his life, I did an emergency tracheostomy and put a tube in so he could breathe. And I saved his life.
During transport to the ambulance, though, the tube came out and the patient passed away. Steele reported the incident to GMH management and claims that Dr. Lizama told him that he had performed an unlawful and egregious procedure that would result in him losing his medical license and hospital privileges. The physician defends his actions even though he was never interviewed or given an opportunity to do so by GMH management.
I'm so relieved to be out of that dreadful situation of having to deal with the GMH administration.
But Steele isn't ready to throw in the towel just yet. In fact,
the CEO, I'd love to run that hospital. I'd like to take over as the CEO, Vega's position, and I'd appoint another medical director, probably Dr. Leon Guerrero.
Dr. Steele hasn't officially applied for the permanent administrator position, but says if given the opportunity, he would merge GMH with public health and mental health, creating one entity that would provide primary and secondary health care.